the first step while post processing is to wear some form of nitrile or vinyl gloves. Okay, so the first step is you release the build plate. Be careful because there is excess resin everywhere. All right, so a lot of times this is very viscous, so it can directly be taken up and you can directly take it in a place where you're going to post process it. So I think I'll sit down so you all can, I can sit on this chair. Okay, so when you reach this stage, what did you take care that when you lift this build plate from its area, you don't end up having small droplets of resins falling everywhere, because that's also not something that's easier to clean and handle, especially when it seeps in through this vat into your screen. Okay, so once you're done with this, you cover this. If you're not going to change it, have something to cover it from time to time. You can shut the machine off and then you can move on. Okay, so once this is done, we have a tray liner over here which we can successfully dispose. So one thing that you have to try and remember is, as we discussed, the resins are not good for the environment. They are toxic. That's why we don't handle it with bare hands or have direct skin contact with it. So do not get into a habit of washing it under water unless a manufacturer gives you a resin that is water washable. So you get resins that are water washable, that you can directly wash it with water. But other than that, all the resins have to be washed with 99% isopropyl alcohol. All right. So other than that, the first thing that you will try and do is scrape the prints of the build plate. Okay, so it's not, such type of scrapers generally come to you from the printer company or the manufacturer itself, not the resin people. Okay, it comes with your printer. So you take that and you scrape it. All right, not difficult at all. I will keep these for you guys to do it. All right, so once this is done, you actually, in a normal process, either you can use some form of, see, can you see these supports have not got printed? So that means something has not gone right. Okay, this is called a failed print. Okay, so either the supports that were added were not sufficient or something went wrong there. So we will go back and we will check the resin. So good, there is a failed print, so you will get to see how do we manage it. All right, so once you scrape this off, it then goes into your wash and cure unit. All right, so in normal routine cases, if you have your washing unit washing your models, that will not be the IPA that you will wash your surgical guide resins or any of your biocompatible 3D prints in that machine or in that IPA. You can have a different chamber for it, or you can keep some other things in that. So in our case, for example, if this washes model resin, you shouldn't be washing your biocompatible stuff that is going to go into the patient's mouth with the same IPA, because the toxicity certification of this and that is completely different. Okay, so you cannot make anything that is going into the patient mouth with the model resin, ideally. Okay, it's not safe, it's not FDA approved. So as you go higher, you have resins which are class 2 ABC approved, that shows the amount of hours it can stay into the patient's mouth. Like for example, a surgical guide resin is a class 2A certified resin. Then you have resins which are slightly for a longer period of time, such as a splint resin that stays for more than 1 hour into the patient's mouth. And then you have resins which are class 2C certified, which stays in the mouth almost permanently, such as the permanent resin. Okay, so you have your surgical guides, your splint resins, your tray materials, you have resins to make custom trays also. So those tray materials, so they are all class 2A certified for a few minutes to an hour, something of that sort. I will find that chart and help you all if at all that interests you. Then the second category is a couple of hours, such as your splint resin. That's why ideally you shouldn't be using a surgical guide resin just because it's transparent to create a splint, because it does not have the same certifications and it is not recommended for the same amount of hours to be worn inside or intraorally. Okay, so from your from your splint resin, you have your temporary resin, which goes from a few hours to a few days to a few weeks, and your permanent resin, which goes from few weeks to a few years. Okay, so your crown and bridge resin falls into the third category, which is few days to a few weeks sort of a category. Okay, so once this is done, we will now, you can pause. Shruti, because I am very comfortable with this and it's a transparent resin, I can actually move this and identify whether there is any failed part or anything stuck inside or no. So everything looks okay here. So good for you. We won't be removing this and filtering it. So if at all there is a failed print inside, I will then show you what we need to do for that. I will glove up again. श्रुति, ये दे दो ना मेरे को, अपना स्प्रे दे. So this is 99% IPA. So this is how you will always clean your spatula. Because otherwise, how we have a surgical chain that we don't break during surgery, you will start creating a chain where you will have contamination of resin passing on. Okay, so you need to break that chain. So once we are done, so one thing that we have confirmed, that we don't have any broken or cured segment inside the vat. So that's something that's okay. But since I've had a failed print, I'm going to do two things now. If there would have been something that is stuck inside to my vat, there is a feature in this printer in which you have to imagine that the vat is there. Okay, the vat is there inside. Right now I'm going to remove it because I want to show you that, because there is no cured fragment inside, but there is a feature called vat cleaning. When you turn on vat cleaning, what it does is it turns it on for a stipulated period, which is selected by you, 10 seconds, 15 seconds or something like that. So what you do is, instead of scraping off that much cured part, you cure one full layer, and then it's very easy to peel off and your FEP is saved. Okay, so you go to tools, you go to vat cleaning, you select the number of or amount of time that you want to do that, and you let it turn on. Once it has finished curing, all you have to do is remove the excess resin into the bottle bag with a strainer in between, and then just take the soft spatula or a plastic spatula like this and just go underneath and just flex it out. In that case, you don't have to scrape. In earlier days, when we used to have a failed print, which we used to have very often at that point of time, you had to literally scrape it, and in the process a lot of times completely destroy your FEP film.
So in this case, suppose if there was like a failed piece inside, that also gets picked up when you...
So if you have a failed print, the first thing you do is you take your plastic spatula and you move it around. You feel it with your tactile sensation, that is there something stuck on the film or no. If you feel that yes, there is something stuck, now you need to go to tools and you go to vat cleaning. You select vat cleaning, you cure for...
When we are
Yes, you have to keep that only if something is stuck to the film inside. Okay? खाना निकालना शुरू कर दो laptop. So in our case, we do only models here. So I do not have a separate plastic chamber of this size because this has magnetic wheel inside which rotates, which we will see it in action. And so what we do is for our all our biocompatible, we have separate denture boxes which we use with its own IPA and labels. So we have a separate box for surgical guide, separate box for pink denture resin, separate box for splints, and separate box for crown and bridge. All we do is we put in the print, we put it in an ultrasonic cleaner, and we start the cleaner for 3 minutes. Once it's finished its cycle, you remove the print, you let it evaporate, and then you go into post processing. So let's start with the post processing. Let's imagine that in your case you're printing only surgical guides and not models. In my case, the volume of my models is way higher than all my biocompatibles, so that's why I use this for that. So I might in a week print couple of guides, but in a print I might be ending up washing about 100 plus models. So that is why for me this is the right way to go about it. Won't come out. Dr. Mir, can you pull it out for me? Perfect. So, no rocket science here. You just absolutely carelessly you can scrape it. There's no problem there, and you drop it in. The key here is, yeah, the key is that the entire print should get submerged. So this washing unit can actually have your entire build plate go in. You can actually submerge your entire build plate inside like this, or have it go in like this. Okay, so you can have your entire build plate go in and wash the print over there. All right, so once this is done, you close this in, take your washing chamber, it's magnetically attached, you set the washing time. So we'll set the washing time right now to 4 minutes and you start it. So it always runs on alternating 2-minute cycles. So 2 minutes go clockwise, 2 minutes go anti-clockwise. If you wash more, so then it'll keep repeating that over and over. The same IPA that was used for washing. Okay, you spray the build plate with it, and of course you should be wearing a mask when you're doing this. All right, you take a tissue, थोड़े tissue दे दो ना एक दो. एक एक दो ना. अच्छा, okay. Okay, so you take that nicely, wipe it clean,